Thank you for the invitation. So I'll try to share with you some thoughts, some things that we are doing. And I start with this landscape. I'm actually a gynecologist and I'm doing surgery, but today we're going to talk about prevention. This landscape for me is like outside. I mean, it's nice, and it's a prevention. It's like that. Everybody wants to go, but you don't know where to start. So we had the chance today to have really high-tech and very impressive presentation. And I'm sorry, I'm going to have really low-tech and very simple things that I want to share with you. If you're not a physician, maybe these numbers do not talk to you, but for me they're very important to tell you how low-tech I want to go. 70% of the diagnoses so far in this year are done just by questions. 15% when you add the examination, the physical, and the fact that you are looking. Only 15% of the diagnoses are done by MRI, genetics, blood, whatsoever. When you think about it, we don't put so much on the first ones. And this is what I want to share with you today. If just one question could save your life, because it's simple, 70% of the diagnoses are done by questions. If one question could save your life, can you accept that your physician forget to ask you this question? Can you accept that he doesn't even know the question? Or he doesn't feel comfortable to ask you the question? And I had the chance to have in my team different physicians with different background. And I realized that physicians sometimes don't ask the question because they don't feel comfortable with the answer, with the moment. They don't want to handle the answer because they know they will have debate. They know it's going to be too long. So their structure in the question is not as efficient as it could be. So let me have some dirty talk. I have two conflicts of interest. I'm a gynecologist and I'm French, so I'm allowed to have dirty talk. You on the back. What if I ask you how many sexual partners you had? I don't want the answer. You there. What about drugs? Are you on cocaine sometimes? No, not really. And you there? Are you vomiting sometime after eating? You don't like this question. Me neither as a physician. They're simple and they can change your life. Number of sexual partners, it's proved to increase the risk of HPV, that you have a higher risk of cervical cancer if you have more than 10 partners. No one ever asks you that, but this will change completely your routine checkup. Cocaine. Who asks you if you're on cocaine? 20 million person in France now, in Europe. France more about wine, but in Europe are using cocaine. Cocaine is the first cause of heart attack for the people that are less than 50 years old. No one is asking that. Anorexia, alimentary trouble. We do not ask that because we don't feel comfortable with that. So let me introduce you Veronique. She's a police officer, and she came to the clinic. She had everything. When I say everything, we are very generous in France in social security in the checkups that we can do. So for fertility, she had MRI, genetic, laparoscopy, stereoscopy. She had everything. So we decided to plan a treatment, in vitro fertilization, and we were planning to make it in 2 weeks. But unfortunately, between the 2 weeks, she had a massive heart attack. And this makes me think about, can we screen everybody for everything all the time? And the answer is no, we cannot. But I'm not a cardiologist. Could I have done something differently with her? No. Or maybe I could have done something different. But this is a point that is very important for me. 57% of the patients, and if I ask in the room how many of you have already lied to their doctor, 57% of the patients already lied to their doctor. What do they lie about? They don't lie about the fact that they have an appendicitis or that their father was died because of a heart attack. They lie about their behavior. And the problem of prevention is a behavioral disease. So how can we handle that? The patient is lying, and we have to act on that. We have to find the way we motivate the patient on that. So why prevention fails? Everybody wants to do it. Everybody talk about it. Everybody does marketing about it. But the first answer, there is no time for that. There is no business model for that. And there's a lack of motivation because you have to be very motivated, and it's completely different than curing. I mean, you have to have other tools and other consultation to make prevention. You have to have other numbers. You have to have things that can help the patient and the physician to be incentive into that. And I'm saying also because we don't ask the right question. So just a little bit of history, because the importance of questions. Socrates, the philosopher, you all know, never write a book, never write a letter, never write a line, but change completely the history just by asking questions, because you have the answer. So when you look at AI, it's a way to ask differently the question. You can look the microscope, the telescope. We ask questions on different level. And what I'm saying today is with AI, we have the deep question. We can go deeper than what we do normally. So most of us, we use AI to have answers. What I'm saying is we can use AI to have the best question. The question of all the experts. And when you go to a consultation, if a patient got a headache, you will not have the same question from a GP than a neurologist. But it's just question. It's not examination. It's not MRI. It's start by question. And this is what we're trying to do. We have AI agent, that's called Socrates, but with a K, that we implement in every single consultation. So we decided that AI doesn't judge the patient, can ask many questions even if they are uncomfortable, even if they are awkward. Imagine if I ask you if you do cocaine when you're consulting because you're having a urinary infection. You will think that I'm the weirdo, okay? You will not feel comfortable, I will not feel comfortable about it. So what we do, the patient take an appointment and we send the AI agent to ask question, to record his voice, because now it's easy also to have different in the voice for the depression, for many things. And from day one, we decided not to have any chance to have hallucination. There's always a physician validation. We ask questions about many things, all the systems, no matter where you come. Sometimes the question that we ask is longer than the consultation. It's about 10 to 12 minutes to fulfill the questionnaire. And regarding your personal history, your family history, then we dig deeper and deeper. To build that, but it's not the aim today. I mean, we check with the expert what are the scores that are important for them in consultation, because I'm a gynecologist. When someone is telling me that she doesn't sleep well, I don't know the next question as an expert of sleep disorder. I will tell her, I'm also sleeping bad. So what can I tell you? But what we do, when the patient fulfills that, we give what we call tag for the physician. It's in French, but it's not important. I mean, no matter where you come, we will give the risk factor to the physician, and we will already provide to the patient his mapping of risk factor and personal recommendation, or of exam he has to do, or lifestyle he has to change. So we've been doing it on our clinic for the last 3 months. We see around 50,000 patients a month, and now we're doing it for every single consultation. And the results for me are more than important, but if there is only one concept that I want to share with you, I call it POP, personalize, opportunity of prevention. We want to say that prevention, you have two ways. Either you go to the longevity fancy clinic, either every time the patient is here, you take the opportunity to look for the preventive and personalized things that you can offer him. And this is what we do. The result, 78% identified POP for the patient, 52 extended scopes. That means that they were not related for the reason of the consultation. The patient came for a condition A or for a specialty. In 52%, we find something that is not related to the consultation. 86% of patient preference because they feel, and that's true, that we have a holistic approach and that we ask questions that their physician would have not asked. The ones that do not ask it is because they find it too long to answer 10 to 12 questions, but we do it 48 hours before the appointment. So this is what we say, prevention is not an option. And this is just a mapping, but I wanted to show that no matter how you get into your the pathway that you have, you will have it, even it's a small consultation or a cancer consultation for a fever, whatever, you need to have the analysis of the opportunity. What could have we done for this patient? She said she was tired. We said, okay, it's normal with your job and the fertility. This is normal. We cannot do anything. She said she had shortness of breath. We said, okay, you have to relax, and it's her anxiety. And she said she had mild pain. We said, with everything you're carrying as a police officer, that's fine for you. We try with our system, and if she had answered yes to any of the questions that the system asked her, we would have changed completely the direction of what we could have done. So we are today, and maybe this is my second conflict of interest, we are the world-class business leader, but no one is talking about business here. So as I'm a doctor, I can talk about business because it makes sense. No one is seeing prevention as an opportunity of business. But I do. I didn't know what was my population of patients that was consulting. And this is my population of patient consulting. I didn't know the risk factor. We were focusing, developing specialties and specialty, and then realized that almost 50% of the patients declare that they have difficulty for sleeping, that they have strong history of difficulty for sleeping. I had no one in the team to make it. 6 months later, I have the biggest team in France to analyze and treat the difficulty of sleeping, from pneumologists, psychologists. We develop everything. And the patient is not coming from that. She's coming no matter for what is she coming, and she has the opportunity the same day to see the other specialist. If we were not in healthcare, we would have called it cross-leading, but it's prevention. I mean, this has a strong impact on the public health. What's next for us? We showed, the first thing that we show is we improve the revenue of our GP by 30% by implementing the prevention. The second thing for us is to show, so it's a long term, that we have an impact on national health priority, because it's a public things. And we do not really have the choice. I mean, prevention, everybody shows that for €1 that you invest, you have a ROI of €4. So now we're working with the social security and with private insurance to show that, because we have the numbers, and so we do medical economic. But we follow the patient, and because we follow the patient, the amount of data that we have are really big. So we are launching a joint venture with a genetic team to make a full system and to make an infrastructure of prevention and to build a large preventive model and to make it completely open source. I mean, my conviction is we use really high level for treatment, for cure, and we have diagnosis and genetic for that. But for prevention, in France, there is a joke. We call it the 5 vegetables a day. That's what we do for prevention. We just do marketing for that. So what we are trying to do is bring the high-level tools that we have for treatment into prevention, because I'm sure there is a lack of tool for motivation and to implement the prevention. So this picture, I had the chance to be in Togo, in Africa recently, and I was giving a lecture about what we do for prevention. And they told me a sentence that was really inspiring for me. They told me, you know, a mosquito can wake up an horse. And they told me, you do not need an MRI, you don't need a difficult surgery or difficult exam. You are showing us that with scaling questions, scaling the good question, and a very cheap, you can change the prevention direction. And they told me, I was sure that they will be, okay, that's nice, that's what you do in your country. But they told me, okay, in Africa, we don't see prevention as you do. For you, it's almost marketing. For us, it's mandatory. If we have a chance to avoid diabetes, anyway, we don't have the fund to give him the insulin. So if you can help us for that, we'll do that. And we're implementing and we're doing a collaboration in Africa because it's very cheap. So here is my numbers and my contacts. If any of you want to try to implement this is our vision. And we want to make it the more open as possible. So I'll be very happy to help if any of you are interested. Thank you very much.